Good morning everybody and welcome to another Magical Moon video. It is Sunday and the legends have decided they all want to get in on the action. They liked the vet being about and the cameras being about and all of the stuff that's been going on, which we knew they would, being superstars like they are, but they've decided between them, we've got 3 patients now, all okay, all perfectly okay, but they've all seen the vet for different little ailments that they've decided right now to show us. So we've got lovely Grace here. She has a scar on her back leg, and when she arrived we noticed it's quite a nasty scar, and unfortunately somehow she's managed to scuff the scar, which means that we now need to treat it. And because of her age and because of the fact that she's she has been obviously very poorly, we're not taking any risks. So the vet came out, she's on a course of antibiotics and we're treating the cut, as it were. And she's going out at night at the moment, which she's not too keen on, but she's having to because she needs to keep moving about. So, and it's looking really, really good. It looks amazing. Yeah. It does look amazing. But the problem with old horses, especially if they stand in, their legs swell, and that's an ongoing problem for me. I'm always either bandaging or walking them up and down the drive or something if they have to stand in their stables. So she's out, but the swelling can cause real trouble. So she's in at the moment, she's going to be treated, you're going to watch, and then her and Charlotte are going to pop back out in the field for a little bit and keep them moving. Yeah. Our next patient is, I'll let you talk about this one. The lovely Ginger. Ginger had a little, some of you noticed and commented on her right eye, she had what was the bit, I think it was an ulcer where there's a little bit of discoloration, and some of you picked up on it. Her other eye now, she's either, there's something going on. We believe it might be an ulcer, we're not sure. The vet put his special stuff in it, had a look, and he's prescribed eye drops for 3 times a day for 5 days, but in the meantime she has to wear a mask to keep it covered so that she's not, and keep the eye in the dark. Yeah, keep it in the dark, keep it protected, any flies or any stuff going on, so we've got to keep it clean and keep it treated. And she's loving the extra attention. And then we knew he'd be trouble, Mr. Defouquet. So Epan has decided, obviously he's mourning, which we understand, and he's grieving, and he's high priority on our list, so we are watching him literally 24/7, and that is not a joke. But he's taken very, very well to Max. Max went out in the field this morning and Epan was calling him, but he has, we think, a bit of an infection or something in the heels of his feet. Because of all of the wet weather that we have and the mud, sometimes it can just get into their feet. And he is a very, very sensitive soul in general. You know, when he's hurt himself in the past, you'd think like that was the end. But actually, you know, a few painkillers later and he's fine. And he has, obviously, we're feeling very, very glum and down because he's lost his little wife. He's now got a bit of pain going on as well. So he's really, really, not a happy boy, is he? So I think he's feeling very sensitive. Absolutely. As are we all. We're all very tearful. And it's not nice, but he's definitely feeling a little bit grumpy at the minute. So the vet came out this morning, didn't he, to look at the painkillers that we're giving him and just to try and give him a little bit of a nudge the right way. And this afternoon, he's definitely, I think he's feeling a bit better. The good news is, so he got a clean bill of health insofar as His heart, his lungs, all his movements are fine. So generally he's good, his temperature is good. So all those parameters are fine. It was a bit of a worry, and I guess we're a little bit sensitive to it more than ever at the moment because of what's just happened with Liv. And that's a spin-off from it, but it's always better to be safe than sorry. So we're going to go round. We've got lots to be getting on with apart from the normal stuff, but we're going to do the horse hospital, which is treating the patients and just sharing that little bit with you. So hope you enjoy it. And
just a bit of a warning, lovely Grace here does have to have an injection. So if anyone is not keen on injections, when we go into Grace's stable, you might want to go and get a cup of tea and then pop back when we'll give you a shout when we're back on and we're over to Ginger.
Hopefully, well, it's a sleight of hand, so you won't really see it, but just to let you know what's going to happen. And then, we'll move on to
the next patient, and then the next patient.
Right, let's get on with it.
See you soon.
Okay, so one patient down, 2 to go. She was really good, a proper pro. We did an intermuscular injection, which is, they've got lots of muscle, and as you saw, she didn't flinch, so no harm done. What it means is she's had day 2 or the second dose of a 5 course, so 3 more to go. But yeah, looking forward to getting on and seeing the next patient. Let's go.
So Charlie's just got back from a lazy afternoon hack with the delightful Magic. Was he okay?
He was very good, but a bit of a monkey, but other than that, he was quite good.
Nothing unusual there. So now it is the untacking, cleaning of the tack, Mr. Moon, and grooming him and settling him down for the afternoon.
Yeah, I love grooming Magic because he glistens, because he's an Alcatechy. A little bit of homework for you all.
Yeah, so he's an Alcatechy. So look up Alcatechy, the golden horse, and you will find Magic. So yeah, he's very, very special. The light isn't on him at the moment, so we can't really show you that well, but he's got the most incredible coat. So Charlie's going to get grooming, and I'm going to get back to Dr. Nick, who's with our lovely Ginger. There she is, look at that, sporting a very flashy eye mask and a pink eye. I made it pink for her, just so she can feel a bit more girly.
Patient number 2, little Ginger, and as you can see, you might have just seen when Jenny put the camera on her, there was a bit of a tinge of green. It's not that she's turning into some horrible monster. That's just the remnants of what the vet put in her eye yesterday so that he could have a look. My job now, I've given him a little wipe and I've just got to put her eye drops in, and then we'll get her lovely looking mask back on. So it's a good job. Now that's done, good job. We'll put your little mask back on. Good girl. You're a good patient. Good girl. We're here with patient number 3, who is the legend Epan. I have the stuff here that I'm going to put on his feet to treat those heels, and then we're going to bandage his leg because he has an old jumping injury which could be causing him a little bit of aggravation. So first things first, let's get this done and then we'll get the bandages on him. Let's go. Everyone here at the horse hospital has had their treatment. Epan's just had his temperature taken. We didn't really think you'd want that sharing, so it's all good. He's done, and now it's carry on with whatever the day brings. So let's hope it's all quiet and we will get on, and we will see you very soon.